This episode is brought to you by Nespresso Virtuo Coffee Machines. Ready to enjoy the bold flavors of barista-quality Nespresso iced coffee at home? Simply fill a glass with ice and press the brew button on your Virtuo Pop machine to enjoy rich double espressos roasted to stand up even when chilled. Refreshingly bold iced coffee. Refreshingly easy to make at home. Visit Nespresso.com to shop now.
Jif peanut butter. It's that jiffing good, it doesn't really need advertising. So instead, enjoy the calming sounds of the ocean. Jif. Ooh, it's that jiffing good. Get your Jif at Jif.com.
Learning through play starts with Lego Duplo. With Lego Duplo, toddlers can develop real-life skills while having fun with colorful bricks made just for them. Large, easy to grip, and safe to explore. When children express themselves with Lego Duplo, they build patience, problem-solving, and empathy. See your child learn perseverance and self-expression with everything they imagine and create. Visit lego.com/preschool to learn more.
Man, you are one pathetic loser.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
Yeah. From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio that's now exclusively a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. Gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Please check out stuff.drsteve.com. That's stuff.drsteve.com. You can get the Wet Brain card game. It's a really fun party game made by your old pal. And I have 24-hour turnaround. And it's a little pricey for a card game, but it has all exclusive, custom artwork, and the quality of the cards is fantastic. And check that out, stuff.drsteve.com. You can scroll down and you can get the Roadie robotic tuner and also the Roadie coach. And this thing is an amazing gift for anyone on your shopping list that has a stringed instrument. Check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. He will send you some stupid weird medicine tchotchkes if you say that you're a weird medicine listener.
Yes.
And his CBD nasal spray is literally the best product on the market as far as I'm concerned. And it's the best CBD nasal spray that's ever been made, in my opinion. That's my opinion.
Yes.
Check us out at patreon.com/weirdmedicine. Doing some interesting things there. There's some old episodes that cannot be heard elsewhere. The episodes that are publicly available start at 300, so there's 300 episodes that you can't hear. And I'm putting those up sort of sequentially. And then also they get all the video things that I do for other shows that I may not want to put on my YouTube channel, but I'll put there. And they get everything else that might go to members on YouTube first, will go to Patreon first, and then they get to see all that stuff before anybody else.
Gotcha.
So, and it's cheap. It's $3 a month. There's no tiers. There's just the one tier. And if you are still on one of the other tiers and you're paying more than that, it's not going to hurt my feelings if you drop down to that $3 tier. If you don't, I appreciate it. It's awesome. Thank you. But $3 a month, it's nothing. And we're going to be doing live streams and some other things. It's all coming. If you want me to say fluid to your mama, cameo.com/weirdmedicine. All right. Dr. Scott, you got anything?
I've got a couple of good ones, actually.
Okay. What do you got?
From the Fluid family, I must
Yeah, if you want to hang with the Fluid family and ask us questions live during the show, go to youtube.com/@weirdmedicine. Hit the like and subscribe, and then hit the notification button, and you'll know when we go live. You can also click join, and then just click accept gifted memberships. Myrtle gave out 20 memberships before this show. And that happens frequently. You get members-only content and stuff like that. It's only 99 cents anyway. You buy it for yourself, whatever. All right?
You ready for this?
Yep.
We've actually got three good ones.
Okay, good.
Yeah. So Amy C. wants to know why dementia patients become horny as shit. My mom went to visit my dad during a nursing home visit and got felt up the entire time.
Oh, yeah. Well, there's a dysregulation of inhibitions.
Yeah. They're much more free-flowing, and they don't.
Yeah, there's we have the id, ego, and superego, and the superego kind of keeps us from just grabbing tits and
Butts.
asses and stuff all the time.
Well,
and that is one of the things that's dysregulated in certain forms of dementia.
Well, and you'll see that too in early childhood and in dementia. So as the spectrum kind of grows, you mature and you gain.
You learn not to do those things.
Yeah, like the waitress, and I'll never forget my little nephew. We were in a restaurant, and he's like 2, and the waitress turns around, he just smacks her right on the ass. And we all just kind of looked at her, and she just grinned. She knew it was him.
Yeah.
But
it's funny if a 2-year-old does it. It's funny if a
your uncle
7-year-old does it, or
your uncle does
it's
it.
still kind of weird.
Yeah, it was pretty good. But that's disinhibited.
Yeah,
would be the thing. Yeah.
Yeah, there was, and let's just say I heard this story, a guy who had dementia, and we will grade dementia in 7 levels, and then 6 and 7 have sub-levels. But for someone, say, to be in hospice, they need to be level 7C, which means they can't walk and they can't talk.
Okay.
So that they've progressed that far. They're just basically curled up in bed making noises, and then also they have to have some sort of complication like frequent hospitalizations or something like that to qualify for hospice. But anyway, that gives you an idea. And then level 1 would just be someone who's becoming maybe slightly eccentric. And so there's this whole not cascade, but the spectrum of symptoms that people with Alzheimer's tend to descend gradually through those levels. Now, someone with multi-infarct dementia, that's, people who are having little mini strokes that are causing their dementia, that'll be stepwise because they'll be doing okay, and then all of a sudden they'll decline. And then they'll be at that level, and then they'll decline again until, that's sort of the clinical way you can distinguish between a dementia like Alzheimer's and a dementia like multi-infarct dementia. Well, anyway.
Gotcha.
So this person, he was probably a stage 4, so he could still talk to you, but it was all just confabulatory. He didn't know where he was, and one thing that dementia patients will do is they'll answer the question they can answer, not the question you asked them. And then they'll just make up stuff like, I'm going to Chattanooga, but they're in Chattanooga, that kind of stuff. Or they'll say, yeah, my son was just here, even though their son was, passed away years ago or whatever. And But this dysregulation is a thing, and this guy would move his bowels anywhere but in the bathroom.
Oh, my.
So in his roommate's closet.
Oh, my.
And he was very constipated, so it would just a turd just leaning up against the wall.
Oh, my.
Yeah.
Bless it.
Yeah. And then, he would escape, and then I would call the administrator. The person that I'm talking about would call the administrator and pretend that they were from the grocery store where they found the guy and say that he had left a present on the meat counter.
Oh.
And they would just go, oh, my God. It wasn't even a surprise.
Oh, my word.
Like, oh, we know what you're talking about.
Oh, my word.
So anyway.
God, that's great.
In this fictional story.
Right on.
Anyway, all right.
Lord have mercy.
What was the other one?
Hey, I've got no.
Yeah, it's dysregulation. Sorry,
Yes.
and that's hard to fix. That one's hard to fix.
Yeah, it is hard. Hey, so the one pun.
And by the way, that'll be me when I get my dementia. I'll just be grabbing
boobs and butts and
just
don't be
disgusting.
pooping everywhere.
Yeah, I won't. I won't do.
That's gross.
I'll just do that in my underwear.
Just in your underwear, of course.
Yeah.
The appropriate place.
Correct.
So the one pun. Once some.
Well, there's one pun.
Oh, one pun. Oh no, here we go. Everybody ready for this?
That's all right.
No,
I'm not.
You got to
doing
do
it.
at least one. You got to do at least one.
Well, I'm trying to think of one I hadn't already done on this stupid show. I'll think of one.
Well, think one. Yes. So
Okay.
you'll probably come up with one while I'm talking. The any good and cheap herbal recommendations for mood, depression, energy stuff. I've been asking Dr. Stephen. He was just wondering if we had any other suggestions for mood, depression.
I have some
energy.
ideas, but you go ahead.
I've got some. I think you can look at two different ways. Number one, I would really work on increasing sleep.
Yes.
So number one, start with sleep, because no matter how much stuff you take there in the daytime, if you're not sleeping well, you're not going to feel well.
Yeah.
So I love, fairly inexpensive stuff would be magnesium supplements, melatonin supplements.
To help you sleep.
To help you sleep.
Yeah,
Yeah, absolutely.
And exercise during the day, not close to sleep time.
Right, yeah.
But it's amazing. Okay, so exercise increases your testosterone. It increases stress hormones that actually can make you feel more light and airy and improve your mood too.
Yep.
Because we get depressed and then we just sit in the couch. And you have to, and then you go, oh God, the idea of just getting up, you have to force yourself to do it. That if you're looking at non-pharmacologic ways,
Yeah,
go
no,
ahead.
totally,
Yeah,
and that's I think that's great advice. So both of those are fairly inexpensive ways to do it. Just supplements, if you're talking just strictly supplements for mood and energy. You're gonna love this, but I do love
Astragalus.
I do love Astragalus. Astragalus is a good one. Of course, ginseng is an old. They're both old Chinese things. But interesting. The last show we spoke of taurine.
Yeah, I was just gonna.
Yeah, so taurine I like as a brain booster, especially if someone describes having some brain fog.
Yeah.
And sometimes boosting that energy will boost your mood. And I think those are great things. But here's the other thing that's super.
What about St. John's wort?
St. John's wort has been shown clinically to be effective. You can go to simpleherbals.net and there's we have fatigue reprieve, which is pretty good. And stress less, of course, both are combinations of old Chinese herbs that have been used for centuries. But here's one thing I always tell people to do: go to YouTube and watch just the funniest thing you can watch.
Yeah,
because you cannot be depressed. You cannot be depressed if you're laughing. So,
there's a book about that where this guy had a horrible medical condition. He just watched Marx Brothers movies and laughed himself well.
Yeah, no, and I don't doubt that for a second. If I'm having a rough day, I'll watch those old Will Ferrell Jeopardy on Saturday Night Live.
Yes,
because it's hard. It's hard to beat Turd Ferguson.
SCTV doing the 5 Neat Guys.
Yeah, I mean, so those were all some really reasonable things.
This will make you feel better. One fun. How about I was wondering why the Frisbee kept getting bigger and bigger. And then it hit me. Coleslaw. There you go.
And to be clear now, laughing won't make you not be depressed. You won't be depressed while you're laughing. So at least you kind of can break the cycle.
I used to be a kleptomaniac, but I took something for it. Coleslaw.
Oh, God.
What comes to mind when you picture the perfect roommate? One who comes when you call, one who doesn't forget to lock the doors, maybe one who doesn't steal your milk just a little bit at a time, hoping that you won't notice. At Apartments.com, they understand that when it comes to roommates, a pet can be your best bet. They're easygoing, they eat what you serve them, and they never clog the toilet. And that's why Apartments.com has the most pet-friendly rental listings on the internet. And with instant alerts, you'll know the moment that your perfect pet-friendly place becomes available. Apartments.com has so many features like 3D virtual tours, the ability to save your favorite apartments, and with over 1 million places to rent, you are absolutely going to find the right place for you. Apartments.com knows that moving can be stressful, but by giving you options, filtered searches, and more, they can help take away some of that stress. When I need a new apartment, I will definitely need a pet-friendly choice. So if you guys need a place that's pet-friendly and human-tolerant, check out Apartments.com, the place to find your pet-friendly place. Thanks, Apartments.com, for sponsoring the podcast.
What does every USAA member have in common? Family. We're one big family who supports the military community and their eligible families. And if you, your parent, or spouse served, you could join our family and save big on auto insurance. Visit USAA.com/join today to check your eligibility. Membership eligibility and product restrictions apply and are subject to change. USAA means United Services Automobile Association and its affiliates, San Antonio, Texas.
Hey, it's Paris. You know I love sparkly things, right? Like stars. Duh. And thanks to Hilton and AutoCamp, I just slept under them. Picture me, serving looks by the fire outside my luxurious Airstream, making s'mores with the kids, while a national park is our backdrop. The great outdoors meets Hilton hospitality. That's hot. Explore all the new ways to stay at Hilton.com. Hilton for the stay.
This episode is brought to you by Indeed. When your computer breaks, you don't wait for it to magically start working again. You fix the problem. So why wait to hire the people your company desperately needs? Use Indeed's sponsored jobs to hire top talent fast. And even better, you only pay for results. There's no need to wait. Speed up your hiring with a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
After Zoomies at the dog park, it's time for Drive Up at Target. In goes a big bag of kibble and one squeaky chicken toy for the good boy. Drive Up that's ready when you are, only in the Target app. Just tap Target.
Turd Ferguson. That's a funny name.
Yeah, it's a funny name. That's a funny name. That damn Norm.
Oh, my God.
They'd watch anything, Norm Macdonald.
Oh, that was just beautiful. And the one other question, if you want one more, we've got one more.
Did we finish up on that? There's got to be some other exercise,
sleep. Yeah, for sure.
St. John's wort, maybe, but don't take St. John's wort without talking to your provider because it has a lot of drug interactions. And what about saffron?
I don't know much about saffron.
Yeah, there's some data on saffron, but I wouldn't just take it. I would take it from an herbalist that knows what the hell they're doing if you can find one of those.
Well, and also there's the and I'll say it wrong, the Shilajit.
Yeah, you think that's good for depression?
Possibly because it helps. And again, this
just minerals scraped off of rocks on Mount Everest.
It's the Himalayan mountains. And
what the hell?
I
know that
there may be benefits.
There is some data on it.
There may be some benefits to boosting immunity and boosting energy and boosting mood levels. How much double-blind placebo studies have been done on? I don't know, but I know a lot of people that take it. I know, one of the first times I saw it was when Stacy had it in here one day.
Yeah,
and,
right.
I remember that. And he loves it, and so I bought some, and I took it for a while until I forgot to take it.
Yeah,
so
it
must not help with memory, I guess.
Yeah,
but But I think all of those things for
well, this will make you feel better. One fun.
Oh, here you go.
I invented a new word. Plagiarism. There you go. I invented that word. Coleslaw. All right.
Oh, my. Oh, my.
Well,
yes.
Parallel lines have so much in common. It's a shame they'll never meet. Well,
there you go. Oh, geez. Hey, what about sunshine?
Yeah. Oh, yes.
So
Thank you.
Okay.
See,
So
I knew I was stalling for something.
Speaking of other great things other than morning wood, morning sunshine. Morning sunshine.
Yes.
If you'll go out when the sun's first coming up and get some sunshine first thing in the morning, in addition to practicing deep diaphragmatic breathing, and that also can help increase your mood.
Yep.
Again,
we don't get enough sunlight.
Free stuff.
Unless we're working outside.
Get our asses off the couch, and that's what I do. As soon as I get out here, I'll go home and I'll work in the yard all day. I don't care what I do, just to get some sunshine.
Yeah.
Feels good.
Now, if you are severely depressed, see your primary care provider and talk to them. Remember, don't do anything we said just because we said it.
No.
Check it all out. And, we don't want anybody out there that's suicidal going, well, I just need to go look at the dawn in the morning. I mean, you're going to need something more than that. But get help. But these things, what I did with my doctor when I went in and my cholesterol was elevated, I said, just give me 12 weeks and let me see if I can get it down on my own. And they'll do that, And if you go in and say, listen, I'm depressed, they'll grade your depression. If it's mild to moderate, and you say, listen, I'd like to try this on my own. What do you think about these supplements and stuff? Talk to them about it. Most primary care providers will be totally fine with that.
Right.
And then, of course, I went back in 12 weeks and I ended up on Crestor.
Oh,
because I just bought myself 12 weeks to just keep doing the same shit I was doing. I'm an idiot. So anyway, physician, heal thyself.
Yeah.
All right. So anyway, you got another one?
That was actually that Shilajit was the third question. Yeah, which is okay. Just wondering about some of the benefits of that.
Well, okay. Let's look up
the Shilajit is scraped off of the rocks and crevices during the warmer months, I guess, in the Himalayan mountains.
It's composed of organic matter, minerals, and trace elements, which we're missing trace elements and minerals and stuff in our diet.
I take the trace element little drops every day.
Really?
I put them in my water every day. Makes a difference.
Okay, so here it says Shilajit is primarily composed of 60 to 80% organic matter, including humic acid, fulvic acid, and humin. Then 20 to 40% human, Humin, and 20, not dead humans, and 20 to 40% minerals with trace elements, according to a study in Perspectives of Integrative Medicine. The global market is 175.6 million. Well, they're just going to scrape all the rocks clean. This is a limited resource. There are some studies that suggest that it may help slow cognitive decline in Alzheimer's disease.
Well, there you go.
So indicating that it's, a lack of a mineral or something.
Or fat around your brain.
Yeah, maybe.
Being sucked off by some certain
Research indicates it may improve muscle strength, recovery, and overall athletic performance. I would like to just get artificial Shilajit, though. I don't know that I want it scraped off of a Himalayan mountain, though. But if we know what's in it,
that's the best way to do it. That's like good, sea salt or
it says
Baja sea salt. It's the real salt that's not been processed.
Right.
Yeah.
It says here that Shilajit contains a variety of heavy metals, including some that are toxic. However, humic substances in Shilajit can help detoxify heavy metals. So. Interesting.
Yeah.
In Dune, they worked behind the scenes. The Tlilaxu masters were working behind the scenes to try to make an artificial spice so that they didn't have to rely on the sandworms of Arrakis to produce it. So I think you could do the same with Shilajit, to be honest with you.
Interesting.
Just find out what's in it and just make it in the lab.
Oh, my God.
And leave out the heavy metals. All right?
Sounds good, yeah. Three great questions. Thank you,
Hey,
guys.
Dr. Steve, got a quick question about rheumatoid nodules.
Okay.
I've had them taken out about 4 times, and each time that I have them removed, they grow back bigger. I was just wondering if you've had any kind of answers on that. Thank you so much. Bye.
Yeah. So rheumatoid nodules are these sort of firm, usually non-painful bumps they develop under the skin in people with rheumatoid arthritis. And they are the most common extra-articular, in other words, outside the joint manifestation of rheumatoid, but only about a fifth to a quarter of patients have it. Now, every once in a while they can cause pain or they can get in the way of something. I usually don't recommend having them removed unless they're involving function of something.
Sure.
You can sometimes inject them with corticosteroids, and there are also disease-modifying anti-rheumatic drugs that can make them go away. But you just inject them, corticosteroids like cortisone or dexamethasone or whatever, right into the nodules themselves. You can do surgical removal if they're large and they're causing significant problems, but then they do run the risk of recurring.
Right.
Now, there are some medications that are used to treat rheumatoid arthritis, like methotrexate, and then these tumor necrosis factor inhibitors. They may actually paradoxically increase the nodules. So talk to your rheumatologist. Make sure that the medication that you're taking isn't making it worse.
Okay.
All right? Okie-doke. All right.
Hey, Dr. Steve,
Hey.
Dr. Scott, Casey.
So,
Hey,
Whoops.
Dr. Steve,
Oh,
got a quick
sorry.
question.
Well, I was going to answer for Tacey. Let's try that again. Okay.
Hey, Dr. Steve, Dr.
Hello.
Scott, Casey.
Hi.
Whoever else is there. I
How
wonder
you
if you
doing?
could expand some on people that have Meniere's disease.
Okay.
I've had that for 30 years and comes and goes, but here late this spring it's coming. It's staying for 2 or 3 months.
Yeah.
Can't get it clear up, but I was reading about a new drug, Ebselen, Ebselen, that they were in the trials on. I was wondering if you could tell me if that is available or is it restricted in the U.S. or something about it. Anyway, thanks a lot. Bye.
Okay, man. So let's talk a little bit about Meniere's disease. The most famous person I know that had Meniere's disease was Alan Shepard, the first American astronaut. And he ended up going to the moon despite having Meniere's because they did surgery on his ears. They did a pressure equalizing surgery in his inner ear to fix it. And it was he was desperate to get relief because he really wanted to go to the moon. And but anyway, what Meniere's disease is a disorder of the inner ear that causes vertigo, tinnitus, noises in the ear, hearing loss, and sometimes a feeling of fullness or pressure in the ear. And it tends to come and go, but sometimes it comes and stays. And the exact cause is unknown, but it is associated with an abnormal amount of fluid in the inner ear's labyrinth. So for whatever reason, it starts producing too much fluid, pressure build up. Now you have these abnormal signals going to the brain causing vertigo and like the room is spinning. Vertigo is different than lightheadedness. Lightheadedness, you feel like you're going to faint. Vertigo, the room feels like it's spinning. If you've ever spun yourself on a bar stool and then stopped and the room, you're dizzy, quote unquote dizzy, then that's vertigo. What we usually use for this in the simple cases is a diuretic called hydrochlorothiazide, and it just helps to reduce the fluid buildup. That's it. Low salt diet, limiting caffeine, those kinds of things. But then surgery can be the thing. So now Ebselen is. Can you look to see if it's been released in the United States.
Sure.
I know that in December of 2024, the company making it announced positive phase 3 results for it, but I don't know if it's been released yet. But it acts as a thing called a glutathione peroxidase mimic, which is an enzyme that's involved in reducing inflammation, and particularly in nerves. So this stuff may have a lot of different applications, but one of those could be Meniere's. So let me see. So Sound Pharmaceuticals completed a phase 3 trial showing positive results in improving hearing loss, tinnitus, and dizziness. So look, go to clinicaltrials.gov, put in Meniere's disease, and put in Ebselen. That's Ebselen. And you may be able to find a clinical trial. Well, hell, this is not SiriusXM anymore. Let's just do it. Let's go to clinicaltrials.gov. Clinicaltrials.gov.
There's a
oh, you find you're doing that?
Yeah.
Oh, you were doing it. Okay, good. Thank you.
Let's see here. Study start is supposed to be 2015. So it's been started in phase 2, phase 3.
Okay, there's one that's not yet recruiting.
Yep.
There's an open label trial, and I would get on that right now. It's they have 4 locations. Oh, no, wait, sorry, 6 locations. South Carolina, Texas, Pennsylvania, New York, Miami, and Boca Raton, Florida.
There you go.
And then the rest of them, there were 4 studies on this. The rest of them have been completed and have data. And then one of them is getting ready to get cranked up, and they're not yet recruiting, but you could email them and try to get this drug. So apparently, let me see if Ebselen FDA approval. Let's see here. Not yet received full FDA approval. Okay? So it's coming. Looks good. The phase 3 studies look pretty decent. And remember, phase 3, those are the larger studies right before they go to apply for FDA approval.
Gotcha.
Okay. Let's see here. They're also looking at, this drug to be used to decrease hearing loss during and after cochlear implantation and antibiotic-induced hearing loss. There are antibiotics that will cause severe hearing loss, one of those being gentamicin. But if it's dosed properly, it tends not to. There's a guy named Felix Cerubi who invented the nomogram that they use to this day for dosing this antibiotic called gentamicin. Felix Cerubi was at the University of North Carolina and then moved to East Tennessee State University, and I think now he's retired. But if they gave Nobel Prizes out for reducing kidney loss and hearing loss, they would give him one. Because these drugs before that, people had dosed them, and you just never knew.
Oh, wow.
You know, all of a sudden you'd walk in a patient's room, and they'd be like, huh? You know.
Oh, geez.
But anyway, and then noise-induced hearing loss. They're looking at Ebselen for that, too, and then for cystic fibrosis.
Oh, wow.
Yeah. Well, because cystic fibrosis patients get a lot of IV tobramycin, which is an aminoglycoside antibiotic like gentamicin is.
Gotcha.
And they get it a lot, and they get it inhaled and all kinds of stuff. So anyway, yeah, that's cool. Very cool. So, yes, thank you for pointing us to that. It was about a year ago that he called in, but I appreciate that. But anyway, all right, let's see. What else do we have here? Let's look here. Okay, here's a good one.
Hey, Dr. Ruse. Evan from Michigan.
Hey, Evan.
I remember when I was in biomedical engineering school reading a study about using hyaluronic acid to replace the nucleus pulposus in herniated vertebral disc. I thought that was pretty neat, but not nearly as neat as the newest use I've heard for it, penile enlargement injection. Just thought that was something right up your guys' alley.
It certainly is, my friend. Thank you. So what he's talking about is hyaluronic acid, more commonly known by the general public as lip filler.
Right.
So what people are doing, and I talked about this at Hackamania as well, people are off-label using it to increase the girth of the penis. It won't increase the length. But if you talk to most women, they'll say girth is more important than length. Although knowing the anatomy is the most important thing, and just figuring out how to do things properly. I asked Lucy Tightbox about that day, and she said neither one of those really matter. It matters if you care about somebody. Women are a little different than guys in this regard, but good for them. But they do say that if they had a choice between length and girth, they would take girth every time. So that's what this is about. So what they're doing is they're injecting hyaluronic acid circumferentially around the penis to give them a ribbed, so they're sort of ribbed for her pleasure, like the old French ticklers used to be and all that stuff. So, but the complications from this, if there ever are any, would be catastrophic. So I'm not recommending it. Right. And it's definitely off-label, and it's being done by physicians that are, doing it for the money. Of course, I can't get too upset with somebody doing something for money, but it's not an approved indication. So I would go real easy on that and make sure that if you did decide to go with somebody that's offering this, that you make sure that they know what the fuck they're doing. You want to see before and after pictures, and you want to talk to people who've had it done and ask them what their complication rate is. Okay? All right. Very good. Well, thank you, Dr. Scott.
Thanks, sir.
Excellent. Check out Dr. Scott's website, simplyherbals.net. Thanks to everyone in the Fluid family at youtube.com/@weirdmedicine. And go to our website at drsteve.com for your schedules, podcasts, and other crap. I'll see you next week. Oh, yeah, check your stupid nuts for lumps.